Friends, hi, Dr. Press is coming to you from the North Dallas Spine Center, and today we want to demonstrate how a spinal decompression procedure looks like for the cervical spine, which is your neck. So come on over this way and I'll show you exactly how this works. All right, so this machine is a DRX 9000. We did another video for this for the low back treatment. Now we're going to show the neck or the cervical spine. And cool thing about these machines, unlike other machines, is there's a device here that you can hold on to climb on into the machine itself, so you don't have to work on laying yourself down or getting yourself back up. The computer and the machine do it all for you, and that's really effective for people that are in a serious amount of pain. So now we can see that the table is going completely horizontal. And the patient's head will be placed inside this cradle very comfortably. And that device, that headpiece device, that cradle, will attach to the computer tower on this end here. And in here we can see Daniela placing a bolster underneath the legs to give the patient support and also take pressure off their lower spine. And here we see her putting the finishing touches on the neck piece device. And now she's going to take a strap and wrap that across the patient's forehead, just to make sure that the cradle is stabilized and it doesn't move during the treatment. Okay, and that is a belt that just came out of the computer tower that attaches to the cradle, and that's where the separation of the pull will take place. And here we can see that it is programmed for this particular patient. Every patient has different settings. That gets stored into the machine itself, so when the patient comes in for treatment ongoing, we pull up their name and that pulls up their settings. So everything is tailor-made for the patient. Here we can see how the treatment is starting, and that's going to be measured in waves. All right, so it'll ramp up really slowly, really controlled to a targeted weight, and it's going to hold that for about a minute. And then after that, it'll decrease to half of the weight for about 30 seconds, and then ramp back up for a minute and drop to half the weight for 30 seconds. And it does that ongoing throughout the treatment, just to make sure that no resistance takes place with the muscles of the spine or the neck. And that's how it's able to overwrite the normal resistance pattern of the body, where the body is not able to detect what's going to happen next and is unable to resist. And that's where true decompression happens, inside the disc itself. And you can see that the patient is very comfortable. All right, they just gave a thumbs up here. So the patient is very comfortable during the treatment. This does not cause any pain. We put patients that are in pain on it and they do really well. So this is effective for treating conditions such as herniated disc, pain down the arm, stenosis, degenerative disc, along with chronic neck and back pain. And I say back pain also because we have found that this has been also really effective for a lot of cases dealing with low back symptoms as well. Now we have to understand that oftentimes compression in the neck can also create compression down the entire spine. And one way to tell is, the next time your low back hurts, try flexing your head forward or your neck forward, and you will feel it worsen many times in the low back. And that's how we can tell things are influenced by the neck, of course. The other thing is every impulse in the body starts at the brain and it has to travel to the neck first. So if there's any cord compression, any nerve compression, those impulses will still pass through, but they'll be skewed in terms of how fast they get through. So oftentimes they're slowed down and they don't reach the lower back or the legs as quickly as they should. And that's where symptoms can also pop up in the low back and also down into the leg as well. So this has been really effective for the treatment of neck conditions. like I mentioned, for also low back conditions too. And here we're watching the computer as it goes, and that's tracking every motion of the machine throughout the entire treatment. These treatments go for about 25 to 30 minutes, and they're super comfortable. Patients often watch TV while they're on it, or they can also take a nap and just relax. All right, so here we see the rest of the machine here. And that part, like we covered in another video, is our setup for the low back decompression treatment. So, and I just want to confirm that this feels good to the patient.
Yeah.
Okay. Is there any pain right now while you're on it?
No.
Okay. Is it comfortable?
Yeah.
Okay. So basically what we'll feel is the machine going kind of up and down, and adjusting to the targeted weight that we have for this particular patient. So, nice thing about these machines also is that you can really isolate what level you want to go after. If the herniation is at C6, for example, all we do is press a button, and that's going to isolate C6 and deliver all the force right at C6. Same thing at C5 or C7, based on where the most extensive damage is to the spine. All right. So if you guys are suffering with any conditions such as neck pain, pain down the arm, or even low back pain or pain down the leg, we do offer a no charge, no obligation consultation to figure things out and talk further and see if this treatment is right for you. It's helped out a lot of folks in the past. It has about an 85 to 90% success rate with the worst of the worst conditions. So we've been doing this since 2015, and it's been really effective. So, and we do this many times to take the place of surgery. Many times these surgeries, these spinal surgeries, are unnecessary, and we can many times utilize treatments such as this to make a complete recovery and not ever have to have an invasive spinal surgery. All right, guys, I'm Dr. Presses once again coming to you from the North Dallas Spine Center, and I hope to hear from you soon. Take care. Thank you.